Today, to kick off our social EM lecture series, I'm going to be talking about redlining. So just a quick show of hands, who has heard about redlining before? Okay, so that's a lot of people. So I hope that at least you learned something new. We're going to really zoom in on what it looks like in Brooklyn and how it's really shaped the health disparities and inequities that we see in the populations that we live in and that we serve at work every day. I do believe that, we have a responsibility as physicians in working in marginalized communities to learn about the historical and kind of political influences that have largely shaped, what our community, what the health of our communities look like today. And so we're going to really focus a lot in on Brooklyn, you'll see. So I hope that even if you've heard something about redlining, you know a lot about it, you know a little about it. I hope that everyone learns something from this today. So first, we're going to define it so that everyone's on the same page. We're going to get into the history of it. Then we'll look at how it connects to gentrification, various health hazards and health outcomes. And then we're going to look at what it looks like today, kind of modern day redlining. And then we're going to close with some practical takeaways that include what you can do as an ER physician in your everyday work, as well as in your everyday life as a member of this community, to kind of respond to these structural forces. So what exactly is it? Let's just define it. So redlining refers to the discriminatory practices of denying financial services, which include things like home loans, mortgages, refinancing, home equity lines of credit to people living in certain neighborhoods. These neighborhoods were labeled as undesirable, and this is almost always because of the racial and ethnic makeup of that neighborhood. It's not about individual credit worthiness. It was really about perceived risk of the area, and that perception was deeply racialized. The term redlining comes from, which you'll see next, is the government actually drew red lines around on maps to highlight the areas that were deemed undesirable and too risky to provide loans and financial support to. So this all started in the Great Depression. The Great Depression saw a wave of foreclosures across the country. And in response, the government created something called the Homeowners Loan Corporation, or the HOLC, in 1933. This was part of the New Deal. And the point of the HOLC was to try to help people avoid foreclosure by helping them refinance their mortgages. But in order to do that, they really had to assess risk. And so that's where these maps come in. They created these things called residential security maps for over 250 cities across the country, including New York. Here we see the map of Brooklyn. This is the real map that they used, or that they created and used. And each neighborhood gets a letter grade based on how safe it was to lend to that neighborhood. So green was the considered most desirable. Blue neighborhoods are still desirable, but a little bit less than green. Yellow neighborhoods were considered definitely in decline. And then red neighborhoods, or redlining neighborhoods, were considered hazardous and really were not to be loaned to. So hazardous really wasn't based on crime or housing conditions. I mean, it was incorporated as part of the assessment, but really this determination was overwhelmingly based on race and ethnicity. And so predominantly Black, immigrant, and low-income communities were marked as red or redlined, no matter the financial standing of individuals. So the government used these classifications to decide whether it would back a loan, and private banks really followed suit. And so you'll notice that Brooklyn itself is mostly red and yellow. So at the time, Brooklyn overall was really kind of considered kind of a risky and decline or hazardous area in general. And I just want to highlight a few areas that we're going to touch on a lot in this presentation. So this area is Bed-Stuy, which some of you may live in. I live in Bed-Stuy, Redline community here. And then Brownsville and East New York are over here. And these are two communities that we serve in our hospitals. So we're going to keep coming back to those neighborhoods. So this is how it worked. So basically the people from the HOLC would go literally into the communities and assess the neighborhood and then come up with kind of their evaluation of how risky it was to lend to that neighborhood. So this is an example. You can like get these from the Richmond's Mapping Inequality Project. This is a real document um, from the HOLC. This specifically is looking at Bed-Stuy. And so what you'll see when we zoom in, if you can, I know it's kind of dark, but over and over again in these documents for neighborhoods that were redlined, you'll see kind of repeated comments on the racial and ethnic makeup of the community or of the neighborhood. And so commonly you'll see throughout it, infiltration of Black people and saying how many Black people lived in the community, and like literally saying like colored infiltration is definitely an adverse influence on neighborhood desirability. So you see this over and over again in different red line neighborhoods. These documents are available to the public. It was not a secret, it was out there in the open. So what that meant was that Black and minority neighborhoods were more likely to be given these Class C or D or yellow or red ratings. And it really it really showed the concentration of Black people living in redline communities. So this graph here is showing the further you are inside a redlined area, the more Black people live there, and the further you are outside a redlined area, the less Black people live there. And then similarly, the more inside you are a redlined area, the lower your home value is, and the more outside you are of it, the higher your home value is. So while Black Americans in the 1930s prior to redlining were already more likely to live in areas of concentrated poverty, this really only exacerbated the problem. So what does that mean? You live in a red and yellow neighborhood, you're essentially unable to get a loan, okay? So between 1945 and 1960, less than 2% of federally insured home loans went to Black Americans. This made it virtually impossible for the residents of these neighborhoods to buy homes, to refinance their homes, get mortgages, and make repairs. This leads to homes falling into disrepair, since you can't, you don't have the money and the financing to repair it, and housing conditions decline as properties lose their value. That then leads into disinvestment in communities. So when values fall, entire neighborhoods experience disinvestment. So that meant that fewer schools, fewer parks, fewer health services are going into redline communities, effectively starving them of resources. This really led to worsened residential segregation and racialized poverty. And what we'll see next shortly, is that the evidence of this is really shown in the health disparities that we see in the populations we take care of in the ED. So let's just look a little bit closer at the Brooklyn map. So this was the map the HOLC created in 1938. Obviously, the demographics of Brooklyn in the 1930s were very different than they are today, but there are still some common features. So back in the 1930s, redlined areas were predominantly Black. And if not, they were home to different working class communities. Bed-Stuy, Crown Heights, East New York, Brownsville, were all majority Black. Flatbush in the 1930s, so where we are over here, was predominantly Jewish and Italian and Irish Catholic. It really wasn't until the 50s and 60s that there was large-scale Caribbean migration, which really did change the demographic makeup of Flatbush. Williamsburg was mostly Jewish at the time. However, in the HOLC appraisal documents for Williamsburg, a lot of the language there is they were in close proximity to Black neighborhoods like Bed-Stuy, and therefore were considered undesirable, for concern that Black people would pour into those neighborhoods. So how does that compare to today? So 80 years later, this is a map of the racial and ethnic makeup of Brooklyn, looking at the Black percent of the total population. And so while Brooklyn has experienced significant migration and gentrification, we see that Black Americans are still largely concentrated in redlined areas. And I'm going to go through a bunch of maps in this presentation. I really want you to remember kind of, again, these areas that are redlined up here, because you'll see some similar trends over and over again. So we also see it now in poverty rates across Brooklyn. So again, this is 2016 data, but we see still East New York, Brownsville has some of the highest levels of poverty, historically redlined neighborhoods. Other areas that were redlined, right, like Williamsburg, have some of the lowest poverty. And that's really a reflection of ongoing gentrification. So I think it's really important to talk about gentrification. So just to define it, which many people know, gentrification is the influx of higher income, often more educated, and often predominantly white residents moving into traditionally low-income minority neighborhoods. Why do some communities gentrify? So there's a rent gap. So historically, redline neighborhoods are often priced much lower than they're actually worth. This makes it a ripe opportunity for investors, real estate people to take advantage of these kind of low prices and that redline communities have had and charge a lot more for it. Build new buildings, hike up the rent. And so this map shows here the median sale price per square foot changes from 2004 to 2014. And we see that a lot of these redline neighborhoods, while had low values from redlining, are really experiencing serious increases in the median sale prices. Green is a higher increase in the median sale prices over those 10 years. This also completely changes the demographics of the residents, right? And so we know that, gentrification, while it may bring some positive benefits in that it can bring potentially more parks, more grocery stores and other amenities, residents are not equally able to access all of those, especially the longer term residents. It also hikes up the price, so people get priced out and get displaced. So a lot of long-term residents in a lot of these redline Brooklyn communities can't afford the prices anymore due to gentrification. And so this map shows the population in white non-Hispanic people in Brooklyn from 2010 to 2020. And we see, again, in some of these redlined areas, more and more white people moving in. And that really causes significant displacement, and that creates even more segregation and poverty. So I live in Bed-Stuy. Like a lot of us live in these communities that are historically Black, and a lot of us are not. And we have to acknowledge that we are part of this problem, right? We're serving the community, and that's wonderful, but we do have to acknowledge that. I think it's really important to say that and understand that. And so Bed-Stuy is a historically predominantly Black community that was redlined. And this graph here shows that the racial makeup of Bed-Stuy alone has significantly changed from 2010 to 2020. So Bed-Stuy has gained more than 30,000 white residents between 2010 and 2020, which is more than almost any other neighborhood in New York City. And then following suit, that increases the rent, right? So this is a graph showing the real median gross rent change over time. And we see that Bed-Stuy, while it used to be more affordable, is now well beyond the kind of average of Brooklyn and New York City as a whole. And so again, that's really causing a lot of displacement for communities like Bed-Stuy. So why does this matter for health? We're going to just quickly look at some of the health hazards that redlined neighborhoods deal with as a result of all of this. So first of all, redline areas, as you know, because all the things we just talked about are more likely to have homes with poor upkeep and maintenance issues. We know that mold, leaks, poor ventilation can cause infectious and respiratory disease. Pests like cockroaches have been linked to asthma exacerbations. And so the maps here show that in redlined areas, it's kind of backwards, but more homes with maintenance defects than non-redlined areas historically. And then this map is showing homes reporting cockroaches, again, highly concentrated in redlined areas. Food deserts are a big problem. So that's an area where people don't have easy access to healthy and affordable food. This map shows supermarket high need areas, which is based on a number of things. But we see that Really what's considered high need neighborhoods for supermarkets are concentrated again in redlined areas. We know that if you don't have access to healthy foods, you rely on deli foods, fast food, processed foods, and that can lead to higher rates of diabetes, obesity, and cardiovascular disease. Here we see in Brooklyn, red line areas are having some of the lowest consumptions of fruit and vegetables and some of the highest consumptions of sugary drinks. Red line areas also historically have less green spaces. So green spaces provide shade, they improve air quality, and lack of can really lead to respiratory disease, different heat illnesses, and overall a decline in mental health when you don't have access to health green spaces that you can exercise in. So these maps here are showing that the percent land covered by canopy, again, very low in some of the red line areas. And then this is green area per inhabitant. So these maps together are showing that redlined neighborhoods have lower tree coverage and less access to green space per person overall. Going right into air pollution. So redline areas have been consistently showed to have higher levels of air pollution. This has to do with them being near highways, industrial zones, and this contributes to respiratory and cardiovascular disease. And again, over and over again, we're seeing these neighborhoods that we serve that are redlined have much higher rates of air pollution. This all leads to hotter temperatures, right? So this was a study of 108 cities looking red line neighborhoods depending on their rating and their average temperature. And in every single city studied, historically red line neighborhoods were hotter than their non-red line counterparts, in some places as much as 13 degrees Fahrenheit. In New York, the heat vulnerability index is a measure of who's at risk for dying during and immediately following extreme heat. And there's a number of things that go into this, but the darker picture here, this was end presentation 1, 2. Okay. The darker picture here is showing that people in our red line communities and the communities that we serve are at much higher risk of heat-related morbidity and mortality. Similarly, there's less air conditioning in those same neighborhoods. And again, we know that this contributes to heat-related illness, respiratory disease, cardiovascular disease, and yeah. Flooding. So this is a map showing moderate risk for stormwater flooding. We just had crazy flooding, I think, on Sunday, and some of you may have seen the videos of the one train. And actually, redline neighborhoods, just from simple stormwater, not like crazy extreme storms, are more likely to have flooding risks and events. And then finally, healthcare access. So when you have a disinvested community, you're less likely to have access to healthcare. And so this is a map showing the percentage of adults who reported not receiving needed medical care at least once in the past 12 months. Again, right in these redline communities. And then this is a graph or a map showing the amount of PCPs per 10,000 adults. And again, lowest in our redline communities. So what does that mean in terms of health outcomes? Well, you could probably predict higher rates of childhood obesity, higher rates of adulthood obesity, higher rates of diabetes in our areas that we serve and that are redlined, higher rates of hypertension, higher rates of late or no prenatal care, and then which is correlated to preterm births. And again, these are very similar maps, right? All of them kind of look the same. And then life expectancy. So life expectancy is lower in our redline communities versus non-redline communities. And we're going to look at that a little bit closer too. Respiratory disease. So this is looking at child asthma emergency department visits, which, is a measure of uncontrolled asthma. And communities we serve and the redline communities, much higher rates. And then ultimately, us in the ED, while we are kind of the front line dealing with a lot of these disparities and health problems in our EDs, it shows in the data in terms of ED visits as well. So redlined areas have higher numbers of ED visits for all different types of visits, and then higher rates of what are considered preventable ED visits. If we look closely at two communities that we all probably know at this point, and kind of just for comparison. So Brownsville was historically redlined and largely disinvested, and was one of the only communities in Brooklyn that is really not experiencing gentrification like some of the other neighborhoods. Versus Park Slope, which we know it was greenlined and has long been wealthy, well-resourced, and residents are generally financially stable there. And so we see that the disparities between residents living in Brownsville in terms of obesity, diabetes, and hypertension are much higher than those living in Park Slope and much higher than the average of Brooklyn overall. This affects life expectancy. So I just want to point out Park Slope and Brownsville are literally 4 miles away. And yet the difference between their life expectancy is 7 years. And so, I just really want to drive home the point that as ER physicians, we're often the first and sometimes the only point of care for people in neighborhoods like Brownsville. And so recognizing these disparities, these disadvantages that people have is a really important step at trying to make it better. So I'm just going to quickly go through some of policy and influences that have affected communities kind of in the form of modern day redlining since redlining. So anyone know who this person is? Yeah, so Robert Moses was one of the most powerful and influential urban planners in New York City's history. He's largely credited as being responsible for why kind of the landscape of New York and the infrastructure looks the way that it does today. He was head of the New York City Housing Authority in 1948, and he really deliberately concentrated public housing projects in red line neighborhoods. He recognized that white communities resisted public housing and generally didn't need it. And so instead of integrating resources across the city, he chose to really concentrate them in marginalized areas like Brownsville, which really deepened racial and economic segregation that we see today. He also was responsible for building the Brooklyn-Queens Expressway and some other major highways that really intersect and go right through a lot of these red line communities. And so he's a big part of the problem. This is a map from the New York City Housing Authority in 2021 of the different public housing projects. And again, notice how they're all concentrated in redline communities. Redlining was ultimately made illegal in 1968 by the Fair Housing Act. But, just because you make things illegal doesn't mean that it really changes anything. So in 1977, the Community Reinvestment Act was passed, which the point of that was to try to encourage banks to loan to disadvantaged communities and make sure that their lending practices were equitable. These were some important steps forward, but unfortunately, it hasn't made a huge difference. One of the ways you can see that these legacies kind of exist is zoning. So I'm not going to act like I'm an expert on zoning at all. This is kind of like new to me and I was trying to learn about it. But zoning is one of the policies that restrict multifamily housing or single family housing in certain neighborhoods. And so they're like laws basically that say where you can or cannot build a single family or multifamily house. And so in our kind of redlined neighborhoods, we see that most homes are multifamily residential, and really some of the other more affluent areas have single family homes, which continues to keep people out of opportunities and segregated. So even though we've outlawed stuff, like I was saying, it hasn't made a huge difference. So our gap today in home ownership rates is actually greater between white and Black people than it was back then when redlining was there. Home ownership rates for Black Americans did increase in the 90s and early 2000s. This was credited to subprime loans that were offered, which are really high risk loans. They come with higher interest rates, larger fees, and they were really given out pretty easily to Black communities, and kind of banks preyed on Black communities with these subprime loans, many who could not actually pay back what the loan was requiring. And so this pushed many Black Americans and Black communities into foreclosures, especially with the Great Recession of 2008 and 2009. And so the gap has unfortunately only widened. It's also still super hard to get a mortgage, lots of disparities in who's still getting a mortgage even today. We're still pretty, the gap is still pretty the same how it was back then. And all of this really speaks to wealth. So home ownership is actually one of the greatest drivers of wealth, more so than savings or income. And these graphs show that, again, the wealth gap between white and Black Americans and white and Hispanic Americans as well has actually only continued to increase over time. So just to wrap it up, I'm just going to take a few minutes. I'll quickly go through this. There's a number of things that you can do. I know that all probably sounds really depressing, and now we're all feeling terrible about ourselves living in these communities and contributing to some of the problem. But there are things we serve in this community. There are things we need to recognize and that we can do. So at the bedside, I think it's really important to always screen for social determinants of health. Ask them about their housing situations, about their food security, about environmental exposures, and make sure to document this information. Engage social work and use this information to help tailor the discharge plans. Be mindful of what they're telling you, kind of their barriers or limitations are, and get social work involved to see how they can help. ICD-10 Z codes are Z codes that are for like different kind of public health and social factors. And I think it's really important that we try to utilize them. There's a number of them that if you just like look them up online, that really, you know, when you discharge someone, put it in the diagnosis, it really helps us see the disparities and helps hopefully the city make an argument to increase funding for these kind of disparities. In the community, so a lot of us are now living in these communities that were predominantly Black, redlined, marginalized. Don't be that weird white person, for the white people in here, that just kind of ignores everyone and does your own thing, you know, like meet your neighbors, like say good morning to people on the street, you know, be integrated in your community, recognize that you are a visitor in a community where people have lived there for a really long time and are seeing their community change from our influence. You can join community board meetings, join tenant union organizations. And when I say to join those kinds of things, I also mean go there in support of the residents who have lived there for a long time. Go there to understand their concerns and uplift their voices. Don't go there to say, oh, this is what I think we need. We are guests in their community, and we have a responsibility to not overtake what they think is important. And instead, I think we really have a role in amplifying their voices and supporting them and learning what's important to them or what are issues in their community and how we can support them. I would encourage everyone also to vote. So there's a really important mayor election coming up. Now that interns, you've lived here probably for 30 days or almost, you can register to vote. This is a really important election. We work for the city. The mayor is low-key like our head boss, and their policies, what they believe in, shape our job and our patients' lives. And so I think everyone should get out to vote, no matter who you vote for. It's really important. There are a lot of local bills and policies that, you know, different candidates support or don't support. And I really want to, everyone should register to vote. You live here now, you don't live wherever you lived before, register to vote here. You can always change it, you know, so get registered. Just know that there are cool centers. We say it all the time, but I looked up a map. Look how close some of the cool centers are. We have a lot of patients coming in for the heat. This is the St. Gabriel's Episcopal Church. It's only for older adults, but then there's public libraries, the Crown Heights Library and the Flatbush Library, where people can go and just be cool. You know, you don't have to come to the ER just to get a reprieve. You can go to these cool centers. NYC 311 is a really great resource. They have a ton of like support and resources for people for different housing issues, maintenance issues, landlord issues, all types of stuff. So tell your patients about this. There's also some kind of more independent organizations. So Alex Graff told me about Just Fix. This is a website. They have all these different tools. Give this information to patients if they have issues with their housing. This group, Communities Resist, provides free legal support for communities that are disenfranchised and dealing with housing issues and displacement. There's a bunch of community organizations. So the Flatbush Tenant Coalition, people can join. The Tenant Block, I know I'm running out of time, so I won't get into it too much, but there's a lot out there. There's so much out there. I didn't have enough time to cover it all, obviously. I just want to point out, this is one of my dear friends, Aurelia. She works for the Gowanus Canal Conservancy, and she leads the youth programs there. And she does a lot of really amazing stuff, helping the youth plant trees in disadvantaged neighborhoods. They also plant a lot of rain gardens, which can really combat flooding. And then there's lots of organizations working on kind of delivering fresh food to communities, and Grow NYC is one of them. And so these are just good things to know about and support. So I wish I had a lot more time to talk about a lot more, but I think that's it. So thanks.